Hey, welcome again to another episode of Beyond the Exam Room. Today we're really excited to talk about hormones. And so I want to introduce you to someone who's has a great passion for hormones. And this is our own and very own Sofia Luna. Welcome, Sofia.
Hi.
Hey, say hello to
I'm
everyone
happy to be
around.
here.
Yeah. So, like anything else, people usually are passionate about something when it's usually personal. So my guess is that's how you got into hormones. So can you tell us your story of why you're so passionate about hormones and
I
how you
think
got
that's
into it?
it's a natural way actually, and that's a good point. As you get older, things change and hormones, change, and you get a little more tired than usual, and your sex drive goes down. You get problems with recurrent urinary tract infections, things like that happen. And so as I was hearing it more and more in my patients, and I was still a little younger. I started to delve into that kind of thing. I started saying, what can I do to help my patients out? I was still not yet really experiencing it, and I think I really fell fell to the ground whenever I started recognizing those symptoms in myself. So it's a natural thing our body goes through. Third decade of life, we lose a pretty big percentage of our normal hormone production, and so we have to look at ways to replace that.
So obviously there's a lot of literature about hormones and just as much as positive and negative.
Yeah.
And so I think the first question I have for you is what is the biggest misconception that public has regarding hormones?
The biggest misconception is that using hormones will cause cancer.
Okay.
That's the biggest misconception. It's actually almost all the newest research shows that using the hormone actually prevents cancer. Prostate cancer, breast cancer, uterine cancer, and all the like. What happens with hormone replacement therapy is naturally it decreases inflammation. Inflammation is known to be a high percentage cause of mortality.
Yeah.
So we decrease inflammation using hormone replacement therapy that decreases risks of mortality, period.
Yeah.
Risk mortality from all causes.
Yeah, it was that one
CBD.
big study that everyone quotes about cancer and then it just been refuted. But
Yeah.
why do you think there is such misconceptions in the market? Because literally, I mean, I have patients that love it and I have patients that are like, oh my God, no, I don't want to die of cancer. You know?
Because I think that it's natural for a human being when they hear one thing about something, unless they can see evidence about it or be educated on it, where our mindset is there,
Yeah.
until you go through and experience it, you don't really know. I am a breast cancer survivor and I happily use hormone replacement therapy with no problem at all. So once I relay that information to the patient, they feel a little more comfortable about giving it a go.
And then you also give them literature that they can read on their own, or
I
what do you
do.
do?
I always offer studies. I give information about certain books that, specifically discuss cancer and using replacement therapy, hormone replacement therapy, especially estrogen.
Yeah, and then well, what was interesting because you're so passionate about it, and I'm curious, and I ask the questions, and even I learned from you that a lot of the symptoms are not what you think they are, right? And so everyone talks about hormones with like libido, obviously, and sometimes they relate it to sleep disturbance, right? And weight gain or weight loss. But name some of the other things that could be a symptom of hormone
when you
deprivation.
walk in the room and say, why was I here again? Brain fog and just the inability to focus on tasks. So, I might be cleaning out the refrigerator one day and then next thing you know, I'm in my bedroom and I left the refrigerator door open when my husband said, what are you doing? And I totally forget where I was doing and can't ever get anything done. And I'm like, I think I need my hormones. I'm off, because it makes a huge difference with brain fog, especially. Anxiety, getting better sleep at night. Mood, sex, and energy is what it's all about, really.
Mood, sex, and energy. Yeah, you mentioned the energy thing multiple times. So, can you explain to the audience how, like, having the right hormones increases your energy level?
It increases your metabolism, decreases your inflammation, it just helps with fatigue, so it makes you want to exercise. When you start doing that, it's kind of like a roller coaster effect. You start to lose weight, you get energy from the exercising, you're improving your circulation because your inflammation is down. All of that brings energy. You get more flow of blood to your brain, so that increases your energy.
Okay. So obviously there's a lot of products in the market, right? You can see it on TV. There's that tea thing, and I mean, so it's how do the public kind of delve through the minutia and not get lost in the weeds to know that what is the right therapy for them?
I think they should talk to their provider. I mean, I've gone on, done the delve on the Google, and you can get really confused. There's multiple therapies. Here at PAC, we offer pellet therapy, we offer injections, and there's compound therapy you can get through pharmacies. You really should know who you're getting your product from. And I think that, talking with your provider is the best way to figure that out. Not necessarily buying online, but there are multiple avenues. You can do injections, you can do creams. There's a lot of stuff available out there.
So let's say I came to you as a patient and say, I'm having all these symptoms, and maybe I would like to try hormones. So what would that would entail? What's the first step?
So, I mean, we would look at first your labs. So we would order a slew of labs, and then I would look at those with you on a follow-up visit. Then we would decide, where are you? Is it something that really would make a difference in how you feel? I'd look at your symptoms, look at your labs, and be able to make a correlation. Once I figured you are a good candidate for hormone replacement therapy, then we would talk about the different options. My favorite option is to go natural, and that would be the pellet.
Okay, so explain the 3 different avenues. You talked about a cream, you talked about an injection, and you talk about pellets. So explain to the audience what those 3 modalities are versus what you see on TV. You buy a supplement, you pop a pill. You know what I mean?
Yeah. What you want to do, buying a supplement and popping a pill is never a good idea because they break down to a lot of trash toxins in your body, and you're not able to excrete those things properly. So you don't really absorb any of that, and they're not very effective.
Okay.
So what I would recommend overall is the most natural way to do it is a pellet. The pellet is more consistent. It's a little small incision you get back here. It's put in under the skin. It drops into the fat layer, and then it kind of gets absorbed by the body and gets metabolized over time, so that for females in 4 months you get a replacement, and for males every 6 months you would get a pellet therapy or replacement. And then what is best about that also is the consistency in the delivery of the men. For women, it's a combination of estrogen and testosterone that we would put in the pellet if they're estrogen ready and if they need it. And then for the male, it's just the testosterone that gets placed. So because it's like a slow release over time, it's super consistent. So you don't have a lot of ups and downs in that.
Yeah.
With the injection, it's a great feeling on Monday and Tuesday, but then Wednesday and Thursday, it's kind of petering out. And then we often get the male that comes in and says, yeah, I feel great the first part of the week, and then I get this horrible crash after.
Okay.
If they're a super active male, they're metabolizing, it might be a good option for them. It depends.
Okay.
There are some side effects that happen with synthetic testosterone. It might cause the hemoglobin hematocrit to be a little thick, and then we have to monitor them more closely. It might cause some changes in the prostate. We just don't see that with the natural pellet as much.
Okay. And then the cream, how does the cream work?
The cream is for females, something that they can rub here on their wrists. Sometimes it's hard to do that because when you're doing squirts like this, it's kind of like when you put too much lotion and then you have to share with somebody else because it's too much. So, you have to be slow about applying it. And if you're in a hurry in the morning, sometimes that can be a problem. It's something you have to do every day. You can also rub it here on your pelvis area and then just kind of wait till it dries, but it is a daily application.
Okay.
It's still a compounded thing, and we can compound estrogen, testosterone, and progesterone on that. So it's not taking an extra progesterone pill at night, and if you need that, and it is effective.
Good. So of course we hear the term a lot, bioidentical hormone versus just hormone replacement therapy. So can you explain to the audience what the difference is?
So that's what that it is that the bioidentical hormone is to mimic our own personal production of, like the way that we produce testosterone, so that or estrogen. So that's what bioidentical means.
Okay, so it's more like getting a custom suit versus just something off the rack.
Oh, good.
Is
That's
that right?
a good analogy.
Okay,
Yeah.
that makes sense.
I like that.
Okay,
I'll use that from now on.
okay, and then, so let's say I want to go through this therapy, and then you and I identify that I need this, right? And we schedule a pellet. and then I get the pellets. So what's the follow-up like? Like how many times do I have to come in to get a lab and all that other
It's
stuff?
really not that bad. So what you'll do is you'll get the pellet, and then I'll see you. You go to the lab. I'll give you orders ahead of time. You get your post pellet, is what we call it, post pellet labs in 4 weeks.
Okay.
And then once we look at those together at week number 5,
Okay.
everything is good. You feel good. That's going to be your dose from then on. Every 6 months, I'll see you and pellet you.
Okay.
And
then,
unless you change or your
Yeah.
symptoms change, I always try to treat the patient's symptoms versus the lab. So if you start to say, I'm not feeling them anymore, we might repeat labs later on.
So let's say I'm excited and you pellet me. How soon, realistically, will I see the difference in my symptoms?
Generally within the first 2 weeks.
First 2 weeks?
Some people really quickly.
Okay.
Depends on how bad you needed them.
And so even with pellets, do you have up, down, or is it pretty consistent through the
Pretty
6 months?
consistent.
For 6 months? So I
Yeah.
feel pretty good for 6 months?
Yeah, I always know when my pellet's about to run out because I'll feel like, oh, I'm not sleeping again.
Okay.
Oh, I'm forgetting when I came in here again.
Okay.
That kind of thing. I'm like, oh, my pellets are due.
Okay. And then what about if there's any major changes in someone's body weight? So somebody loses a lot of weight or gains a lot of weight? Do you
They're
have
not
to make
really
adjustments?
dosed. No, they're not
No?
really dosed on weight.
Okay.
Mm-mm.
What's it dosed on then? It's just purely based on the hormones?
On your current, hormone
hormones, okay.
number, yeah.
Okay, that makes sense. I get it. So then I guess if the audience is listening and they're looking at it and they're interested in it, what would you recommend for them to start doing? Because there's so many different options now. If you go online for hormones, it's like whoosh, all these come up, right?
Right. Come talk to me.
Yeah.
Come talk to me. Make an appointment. Come talk to me. I'm willing to talk to anybody about it. Yeah.
Okay, because you're so passionate about it, obviously.
Love it.
Yeah. Well,
Can't
thank
go
you,
wrong.
Sophia, for taking the
You're
time.
welcome, Dr. Pack. Thank
Appreciate
you for
it.
having me.
Okay.